Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And here today, I have two special guests with me. It's Ruth Patterson and Dr. Shazia Shadab. Welcome, Ruth and Shazia.
Thank you.
Thank you.
It's so wonderful to have you here together. You are, of course, both presenting at the conference together in the presentation, and the title is Dynamic Taping of the Breast for Lactational Breast Abscess. This is, of course, part of the GOLD Lactation Online Conference. So first of all, and I get started with you, Ruth, where in the world are you?
I'm in India and from Bangalore, south part of Bangalore.
Thank you for sharing that. And
Yes.
Shazia, also, are you also in the same area, or you're not together in the same location though, right? So tell me where you're from.
So I come from a land of diversity where my country itself represents a feminine identity known as Mother India. So I belong to Bangalore city. So we both are from the same, like the southern part of Bangalore.
Mother of India. I did not know that. Thank you so much for sharing that. Can you talk a little bit more about that? Because I find that just very interesting, Shazia.
Oh, yeah. So I think like we have people from different culture, backgrounds, religion. So we are all together and accepting. So this is where, and we are emotionally connected. Yeah. So we have multiple festivals and, everyone is taking part in everything actually. So we together form something like this. And this is where we respect, like, see, if you see feminine, it is represented as goddess in certain part of our religion, where a lady is being at the most respected. So this is where it comes in as a Mother India.
That's beautiful. Thank you so much for sharing. I have learned something new today, and I will read up on this because I find that absolutely fascinating. Thank you so much. So let's also talk about your professional backgrounds. You are, of course, lactation professionals in your area. You have done amazing work. And again, I'll get started with Ruth. Tell us a little bit about your professional background and journey.
Yes. My name is Ruth Patterson, and I'm a registered nurse and with specialization on lactation counseling. And I practice my profession with a passion. And I enjoy seeing happy mothers who in turn happy feedbacks. I really enjoy that. And apart from my profession, as a family, I have a husband and 3 children. We enjoy traveling outward trips. So like that, we make a lot of good times and remembrance within ourselves. So that make us boost our energy and rejuvenate to do our job further, and the children to go for studies without any difficult and challenges. Yes. And if I have to talk about, speak about the lactation services and experiences, I have an average line of patients who was having more challenges not solved by the normal counselings rendered by the other teams who is in the same field. So hence, I have spent a lot of time with challenge cases, and thereby I have gained a lot of experience with challenge cases, and then I was able to help the mothers in turn find a way and collaborate with the team, get things done and make the success and make the mother happy. That's where I have found Dr. Shazia, physiotherapist, who was really very helpful and accepted my services which I have asked her, and that's where she helped. And today we are there to present this topic is because I have collaborated with Shazia. So I have a team of lactation counselors. I head the Pan-India lactation team, and we have 24 units currently, and we have every unit across India. We have a lactation department. Everywhere we have a lactation counselors, and I mentor them and make sure all of them train the nurses so that the patients at the bedside, the services given, and then the mothers are able to breastfeed. because lactation counselors alone cannot support the mothers 24/7. So the nurse's role is very important. So I make sure every nursing lactation counselors give a training on 8 hours, 18 hours, and 2 hours for the new joinees, so that some extent they're able to support the mothers at the bedside. So thereby I really passionate on my profession and enjoy my skills.
Beautiful. Thank you so much for sharing that. Yes, it sounds like all the challenging cases come to you. And I love this collaboration that you mentioned with the nurses, that the lactation counselors are training the nurses as well, because you are right, because otherwise, you know, what is going to happen to the mother at the bedside or the parents at the bedside if the lactation counselor is not available? So this teamwork is absolutely fantastic. And Ruth, I also loved what you said about, you know, your passion is really showing, you know, for this profession, that you also share that you go on outdoor trips with your family to recharge your batteries, to get that passion going, and give you the passion to your children too, in different areas, of course, but that they know how to recharge their batteries. I think as lactation professionals, we often are very good at caring for others, but not so good for caring for ourselves. So, you know, we feel like depleted or burned out, but reminding that is so important to also go to nature and care for ourselves, so we can take good care of our mothers and the babies, right? This is, you know, we can't just give and give. We have to go to nature and enjoy the energy that comes from that. So thank you so much for sharing that. And I love how you have that collaboration with Dr. Shazia. So Dr. Shazia, I'll go to you now and tell me a little bit about your background. And also I want to know, how did you become so passionate about lactation?
Yeah. So as you introduced, I also lead the physiotherapy department of Cloud9 Hospital. So I have an experience of 10 years in this field. So I'm basically a women's health physiotherapist. I deal with a lot of musculoskeletal issues and pelvic health during pregnancy and postpartum. So I bring into more innovative and different approach of treatment for a better quality of life. This is what I basically do. And then what happened is, one of my family member had an issue with lactation. That is when I met ma'am. So I understood, like, you know, there are multiple issues which are faced by breastfeeding mothers, which has to be addressed. And this is when we had a conversation, and I saw so many people having, you know, and every issue is different from another issue. So the challenges are different. And this is where I got motivated, and we were like, you know, let me find different methods of treatment of, you know, for blocked duct. I think we have been treating pathological engorgement, breast abscess, galactocele. So they were different conditions which we were able to address with collaboration of ma'am. So I do the treatment, she does the diagnosis, and we also help them to breastfeed. That is when she comes with techniques, what they can be doing, how exactly the breastfeeding can be, you know, corrected. I think that is something which is very important, because I have seen what technique she uses, what is going wrong. I've heard about the palate, you know, upper palate, what is the right technique, what you need to be feeding during that time. I think we both go hand in hand. I say her, in this research, we are soulmates. You know, that is how a collaboration is. I say, like, you know, because she's so skilled in her set, she's excellent. Like when it comes to, you know, she does the right diagnosis. I think that is very important. That is when your treatment gets to the best of your approach. You can treat. So this is what she says, and then I look into what I can do, a treatment method, and we come out with us like excellent results. We have seen mothers coming out of issues, nicely feeding, and, you know, coming back to us and saying that, you know, the journey has been beautiful. I have seen sometimes ma'am doesn't remember, you know, but patient approaches her and says, you know, I just fed my both twins because of Ruth ma'am. You know, it's so beautiful to hear all these things.
Yes,
yeah.
Yes, you have this beautiful collaboration, and it's encouraging to hear for our viewers as well. Maybe they can reach out to other professionals in the area and create some kind of collaboration that you have, which is working so well. And that leads me now to talk about your topic, it's dynamic taping of the breast for lactation breast abscess. And I think I find that fascinating. as a midwife,
Yes.
I've seen what taping can do when we have like around ligament pain and back pain and for the belly and such. I've seen some wonderful results, but for breast abscess, I looked at this and going, "Ooh, this is new. I have to find out more about this." So
Yeah,
I would like you to both talk a little bit about it, about the presentation and what you hope our viewers will learn. And who would like to start with this?
Probably I will introduce. The process is done by Shazia.
Okay.
So my journey started here to approach Shazia on this, which I'm going to talk to the same thing in the presentation too.
Right.
So my story starts, we both of us ancillary services, sometimes we happen to share the rooms, consultation rooms. So there Shazia was consulting on antenatal mother. The leg was cellulitis. It was fully red and swollen, and the patient was in very, very painful. I was in the system. She was treating the patient inside the screen, but I could hear all those things. And then she said, "You put this tape, you will be fine, and come back and meet me by 4 days time." Patient asked, "Any medication?" She said, "There is no need any medication, just go with the tape." So I heard that, and then I just kept quiet. And then it happened, she called after 4 days. And then it happened, I was in the same time, same room, using the system, and she was using the same patient. And the patient came happily and she removed the tape. And then a patient said, "I'm so thankful, I didn't have any pain. I was able to sleep these days, which I never happened past 2 months, which I have been taking many medications, which finally I have to come to you, somebody referred. And then I have been very thankful, I healed. Thank you so much," she was telling. Then after she left, I asked Shazia, "I have seen the same patient. What is that magic you have done with the taping? Why not do it for my mothers who's been struggling with the abscess, and then they have to go for a surgery, and sometimes it will lead into multiple surgeries where they have to completely wean them off from the breastfeeding. Sometimes within a month too. I have seen many in my experience." So when I asked that, she said, "See, I have been trained to do taping, but not for the breast." Then I said, "Why don't you ask your instructor whether it could be done for the breast?" And then really seriously, when I asked, and because that was the cases I have been dealing mostly, and then mothers are in pain, I was not able to help them out, because they have to go for a surgery, next they will stop the breastfeeding due to various cases, multiple blocks. So the moment she said, "Yes, Ruth, I can ask." So immediately she went and asked her instructor, who's not in India, he's a foreigner. And then he immediately said, "If you have a lactation expert and you have your organization agree with the ethical committee, please go ahead, I'm there to support." Immediately she approached me, my instructor gave me a permission, "Go ahead, Ruth." Then immediately I have to, this is a new, I just asked her and she agreed and she started doing that. And then immediately I approached my chairman, who's a neonatologist, who's chairman of Cloud9 Hospitals. Immediately he said, "Ruth, breast abscess cannot be treated without IND, without incision and drainage. It cannot be treated, Ruth. You can't do this." Then I said, "Sir, give me a chance and let me try it out." Then he said, "How do you think breast abscess could be drained with the taping, without surgery?" Then I said, "Sir, it improves in lymphatic drainage. So obviously it helps in self-draining." Then he said, "Go ahead, Ruth." Immediately, he didn't think anything. He gave a
He didn't
permission.
believe you. He didn't think you could do it.
Yeah. Then he said, "Go ahead and do it. Then I need a patient." And then he said, "We have to put this process into ethic committee, because which has never happened so far."
Right.
Yeah, we
So
have to get
ethic
a
committee
ethical
was,
approval.
ethical approval, ethic committee was formed. And then I have approached my senior obstetric consultant, because I need a patient from the obstetrician, not from the neonatologist who is my chairman.
Right, correct.
Yeah, so I have to approach. He said, "Okay, let us go ahead, but then let us get the approval from the committee." So we had a committee and Shazia has to present the tape. They had a lot of questions to ask Shazia, and then Shazia has to go through all the process. Sometimes the way they asked question, it was, they were against this and it never happened and they never believed. And then finally, when a lawyer could say, yes, why not you can't do it? Because you are helping the mothers to feed. So why don't we try? It is not an internal procedure. It is not a major invasive procedure. It is an external application. Why don't you do it? Then everybody agreed. And even obstetricians, they were supportive, most of them. Then I have to get a patients. Now I have to go to my doctor who's having a more patients whom he has been delivering and whom I have been referring them, which I cannot handle them anymore. Breast abscess, I refer them to the doctor. So he said, I went and approached. He said, Ruth, I'll give you 2 days time. I'll give you 4 days time. If it is not resolved, I have to take them for a surgery. I said, I agree with you. Then we used to talk in front of the patient. When the patient comes breast abscess, he is posted the case for the IND. He will call me and he said, now you talk to the patient. If the patient is agreed, then you go ahead with the treatment. If patient is not agreed, I'll go ahead with the surgery. He was so generous, and no patients, no mothers were willing to go for a surgery. They all were willing for this treatment. So happened, he gave me patients, all the patients within 1 or 2 tapes, they have self-drained.
Amazing.
And then surgery was not, now till today he will say, Ruth, you have stopped my surgical process on IND. I have forgotten how to do. So like that, now I'm so happy, not only for a breast abscess. Nowadays I have figured it out. Some mothers, I used to have a lot of challenges with the engorgement. Not a physiological engorgement, it's a pathological engorgement, which cannot be resolved, and then obviously they'll come into less production by 2nd week of post-delivery. So this also I have been seeing more issues. Then it happened, I asked Shazia, not only abscess, why don't you help pathological? She started helping me. Now awesome response. I'm so happy when the mothers are giving a good feedback and they're able to feed continuously. That's make my profession, to serve my profession as a passion.
Oh, beautiful, beautiful story. Thank you so much for sharing. What an inspiration. And Shazia, I mean, how wonderful this has all happened. And by coincidence that, you were overheard there. What are your final, we have to, end this presentation here shortly, because we want our viewers to come to the presentation and watch the entire presentation. But I want to hear from you here as a final word, your thoughts and maybe a little nugget of wisdom for our viewers
so because as ma'am told, I had to speak to Ryan. Ryan Kedrick is an Australian musculoskeletal physiotherapist, so he's into sports. So when we speak about dynamic tape, it's more about biomechanical treatment, as basically movements, sprains, support, like if you have any injury with your neck, sprains, this is where we use it. So there is no research till date. I think this would be our first publication on using it on lymphatic drainage.
That's amazing.
So that is where you would be using. So when I had a conversation with me, he said yes, in Brazil it has been used, but it is used for supporting of the breast post mastectomy. So it is so there was nothing which was done on lymphatic drainage. That is when we started. I had to go through a lot of literature. I had to see a comparison with other tapings, how they work, how we can be working out. So there was a lot of reading which I had to grow, and then I had to see a technique where we can be finding out how exactly we need to tape the breast. So that is when I think I would be putting a more brief on when I would be doing my presentation, what are the different biomechanical techniques, how the tape actually works, and how does it make a difference on the lymphatic drainage. So I think probably would be looking forward for seeing all of them during the presentation, where I can elaborate on what are the principles of taping and how we have been successfully treating more than 200 people without any surgical intervention.
Amazing.
And there is no interruption in feeding. I think that's something amazing.
Wonderful.
It's so it's so content, and you feel so nice, like when you see a mom feeding, and there is, because I'm a mother by myself. I have 8-year-old son. So so it's so nice to see people saying that I'm breastfeeding, and they come back and say I've healed. I had a mother who had gone through abscess, and then we treated her through this method. Literally, she was crying for 2 hours, and she was saying, I don't know how I have to be thankful for both of you, because I didn't have to go through an IND this time.
Yes. Oh, beautiful. Yes. What a success story. And, to avoid surgery is already a big, big success, but then even be able to feed during that time. and keep breast and chest feeding going. And that's absolutely amazing. It's like this beautiful, beautiful treatment method there. I can't wait to find out more. I'm very excited to have you at the conference. I'm so happy that you were able to come here today and talk to me about this, your wonderful work you're doing, and also about this presentation. Thank you, Ruth, and thank you, Shazia, so much for being here today.
Thank you, Christine. Thank you, Jessica.
Yeah.
Yes.
And some more information for our viewers. Now, I know you want to find out more about this presentation. I know you want to be part of this and learn more for your practice, how you can find out more, how to help your clients with breast abscesses. And so I would like to invite you to go to goldlactation.com. There you will find information about this presentation and all the other presentations and the Gold Lactation Online Conference of 2023. We are getting started April 3rd with our opening keynote presentation. That keynote presentation is open access and free for everyone. So I hope everybody signs up for that and shares that with their colleagues and friends in the field. And I hope to see you at the conference. And I know Ruth and Shazia hope to see you there too, right? Bye-bye, everyone. Thank you for watching.
Thank you.
Thank you.